Welcome to the Deep Dive, your shortcut to being genuinely well-informed. We cut through the noise, distill the vital insights, and, well, bring you surprising facts with just enough humor to keep you hooked.
Glad to be here.
Today, we're embarking on a fascinating exploration into a really unique corner of health and healing. The homeopathic remedy known as Carbo Vegetabilis. You might know it as vegetable charcoal.
That's right.
Our guide for this deep dive is a classic text, Homeopathic Materia Medica by William Boericke, MD.
And honestly, you might be surprised by the profound, sometimes quite paradoxical conditions linked to what seems like such a simple substance. Okay, let's unpack this.
Indeed, Carbo Vegetabilis is definitely a cornerstone remedy in homeopathy. It's primarily indicated for states of significant debility, breakdown.
Break down how exactly?
Well, the core idea, what we often call its keynote, is disintegration and imperfect oxidation.
Imperfect oxidation. Yeah, think of it as a fundamental failure of the body to properly use oxygen and just maintain its vital processes. This shows up in a typical carbo patient, often sluggish, maybe a bit heavy, even lazy, and their health complaints just seem to linger, become chronic.
Okay, I see.
We're talking about blood flow becoming so stagnant, especially in the capillaries, the tiny vessels, that you actually see blueness, a profound coldness all over, and even ecchymosis.
Ecchymosis, that's bruising, right, under the skin.
Exactly. Visible bruising. It's like the vital forces are just, draining away. This makes the body susceptible to really severe conditions, including septic or typhoidal states where infections grab hold in a system that's already barely hanging on.
Wow, so it's not just feeling a bit off, it's a deep systemic breakdown.
Precisely. It really comes into play when the vital power is severely lowered. This might happen after significant fluid loss, maybe from a bad illness, or even sometimes from overdrugging. It often describes that lingering debility after other diseases, and it's frequently seen in older folks dealing with venous congestions where blood just pools in the veins. It's even a remedy considered in extreme states of collapse, like those seen historically in, say, cholera or severe typhoid. The patient seems almost lifeless.
Now, this is where it gets really fascinating for me. You say almost lifeless, but the source mentions the carbo patient often has a hot head, even while the rest of them is profoundly cold.
That's the paradox.
Their breath might feel cool, pulse may be imperceptible, breathing oppressed, yet somehow quickened. What really stands out about this state?
What's truly critical and, often surprising is their desperate need for air. The patient must have air. They need to be fanned hard, all the windows flung open.
Really, even if they're cold?
Even if they're cold. It points directly back to that keynote of imperfect oxidation. Their body is literally starved for oxygen. Even if they're barely conscious, they faint easily, they're utterly worn out, and they just have to have fresh air. It's this feeling of being too weak to hold out, like they're right on the brink.
And you mentioned earlier, Boericke notes this remedy often fits people who've never fully recovered from some past illness.
Yes, exactly. Like they never quite bounce back to full health, that lingering low vitality.
Makes sense. And the source also mentions a peculiar sense of weight in different parts of the body. Can you elaborate on that a bit?
Yes, that heavy, oppressive feeling is quite characteristic. The sense of weight can be in the back of the head, the occiput, in the eyes, eyelids, even around the ears, and definitely in the stomach.
A general heaviness.
Right. And along with this sluggishness, there's often a pervasive putrid or septic quality to many of their ailments, coupled with the distinct burning sensation. And like we said, you generally see that widespread venous stasis, the pooling blood, the bluish skin, the cold limbs.
Okay, let's shift to the mind and head. Given this state of, overall ability, what's happening mentally?
Mentally, the Carbo patient can be quite specific. They might have an aversion to darkness, even a fear of ghosts.
Fear of ghosts. Interesting.
Well, if you think about it, it might stem from feeling so vulnerable and weak, There's also a notable tendency for sudden memory loss.
And physically. What kind of head symptoms are we looking for?
Headaches are common, particularly those kicking in after any kind of overindulgence. The hair might feel sore right at the roots and tends to fall out easily. And the scalp can get itchy, especially when they get warm in bed at night. A very distinct sensation is feeling like a hat is pressing down like a heavy weight, or the head itself just feels heavy, constricted. Vertigo, that spinning feeling, can happen too, often with nausea and tinnitus ringing in the ears.
Any visible signs?
You might also see small pimples cropping up on the forehead and face.
The descriptions of the face and eyes in Boericke are pretty vivid, almost alarming.
They certainly are. The face often looks puffy and cyanotic.
Cyanotic, that's the bluish tint again.
Yes, that lack of oxygen showing through can be quite pale, even Hippocratic.
Hippocratic,
Like sunken, hollowed out, almost a deathly look. It's often cold, covered in a cold sweat. Besides the general blueness, you might see mottled cheeks, maybe a red nose, contrasting with the pallor.
And the eyes?
Vision can be disturbed by black floating spots. There's often asthenopia, that's eye strain and a burning feeling in the eyes, sometimes with pain in the eye muscles themselves.
Okay. What about the ears? Anything specific there?
Ear issues can include otorrhea discharge from the ear, often cropping up after those xanthomatous diseases.
Like measles or scarlet fever?
Exactly. Illnesses with rashes. The ears themselves might feel unusually dry, and there can be issues with earwax formation, sometimes with bits of skin peeling off from the ear canal.
Moving on to the nose, Boericke paints quite a picture there too.
Oh, definitely. We often see epistaxis nosebleeds. They can happen in daily attacks, often with a pale face accompanying them. Bleeding might also occur after straining, like lifting something. The tip of the nose might look red and scabby. There can be itching around the nostrils and even visible varicose veins on the nose. An eruption can appear right in the corner of the nostril.
And colds.
Patients might get coryza, a head cold with a cough, especially in moist, warm weather. And that frustrating feeling of trying to sneeze but just not being able to. Ineffectual efforts, the text calls it.
Sounds like a lot of irritation and congestion. And the mouth.
The tongue is frequently coated, either white or maybe yellow-brown, and often covered with apathy.
Canker sores.
That's right. The teeth can be very sensitive, especially when chewing. Gums are often retracted, bleed easily. You might see blood oozing even just from cleaning them. We also see pyorrhea, serious gum disease linked to this state.
Right, now here's where this deep dive gets, I think, even more compelling. The gastrointestinal distress with Carbo Vegetabilis isn't just discomfort. Boericke describes it as a fundamental breakdown, a major focus.
Absolutely. The stomach symptoms are incredibly prominent. Patients get frequent eructations, burping, which might give a moment's relief, but they come with this profound feeling of heaviness, fullness, and often sleepiness right after eating.
Sleepiness after eating. Interesting.
Yes, and there's a tension from flatulence, from gas, with pain that gets markedly worse when they lie down. The eructations themselves can be rancid, sour, or even, putrid.
Putrid, wow.
It's strong language, but it reflects the state. This gas distension can even lead to water brash, that sudden gush of saliva, and sometimes asthmatic breathing. Nausea in the morning is common too.
Any pain involved?
Yes, a distinct burning sensation in the stomach, which can radiate to the back, along the spine. There can be a contractive cramping pain going up to the chest, along with that significant abdominal distension, and a very unique symptom, a faint, gone feeling in the stomach that, surprisingly, eating doesn't help.
That is strange. Usually eating helps a faint feeling.
Not here. Crampy pains might make the patient bend double, and the distress often hits about half an hour after eating. The epigastric region just below the breastbone is extremely sensitive to touch.
So it's not just a sensitive stomach, it sounds like the whole system is just struggling.
Exactly. The digestion is profoundly slow. Boericke literally says food putrefies before it digests.
Goodness,
Yeah.
it's a vivid image.
It is. It captures that stagnation. This remedy is also flagged for gastralgia stomach pain in nursing women, again, with loads of flatulence and sour, rancid belching. Patients often develop a strong aversion to milk, meat, and especially fatty foods. In fact, the text notes the simplest food distresses them.
So even simple things are hard to digest. How does this play out in the abdomen itself?
The abdomen can feel painful, almost like you strained it lifting something heavy. Colic can be easily triggered, say, by riding in a carriage, but a defining feature is the excessive discharge of fetid, extremely offensive flatus, gas.
Okay, lots of gas.
And they just cannot bear tight clothing around their waist. Ailments might also pop up alongside intestinal fistulae. The abdomen is typically greatly distended, bloated, and the patient feels significantly better after passing wind. Flatulent colic and pain in the liver area are also common.
All right, let's continue downwards. The rectum and stool issues sound quite pronounced too, reflecting that putrid state you mentioned.
Very much so. The flatus itself is often hot, moist, and offensive. There's frequently intense itching, a gnawing feeling, and burning in the rectum. An acrid, corrosive moisture can seep out,
Corrosive.
meaning it irritates the skin. A musty, glutinous moisture can also exude. Soreness, itching, and moisture around the perineum are common, especially at night. There can be bleeding from the rectum and burning at the anus, particularly with painful, burning hemorrhoids, varices, as the text calls them.
Hemorrhoids too.
Yes. It's often indicated for painful diarrhea in older people, and frequent involuntary stools that smell cadaverous, literally like decaying flesh, often followed by a lingering burning sensation. White hemorrhoids, raw skin around the anus, bluish burning piles that hurt a lot after a bowel movement. It's all in the picture.
And what about genital symptoms? Anything specific for male and female patients?
For men, there can be an involuntary discharge of prostatic fluid during stool. Also, itching and moisture on the inner thigh near the scrotum.
Okay. And for women?
For women, periods might come early and be unusually heavy, but the blood is pale. The vulva can be swollen, maybe with aphae, those sores again, and varicose veins on the external genitals. Leukorrhea, a vaginal discharge, can happen before the period, described as thick, greenish, milky, and excoriating, causing rawness.
That sounds very uncomfortable.
And one more thing for women. During menstruation, a distinct burning sensation in the hands and the soles of the feet can occur.
Burning hands and feet during periods. Very specific. So, pulling this all together, what does this pervasive imperfect oxidation mean for other systems? How does it impact breathing, the limbs, the skin?
Right, let's look at the respiratory system. We often see a cough, but it comes with itching in the larynx. It can be spasmodic, leading to gagging, even vomiting mucus. It's actually a key remedy for whooping cough, particularly early on.
Okay.
The voice typically gets deep and rough and often just fails completely on slight exertion. Hoarseness is common, worse in the evenings and from talking. There's that feeling of oppression in breathing, especially in the evening, and a sore, raw feeling in the chest.
Any sounds?
Wheezing, rattling of mucus in the chest frequently heard. Patients can get occasional long spells of coughing fits. The cough itself often has a burning feeling in the chest, and it's worse in the evening out in the open air after eating and after talking.
A lot of triggers.
Yes. This remedy is even considered for a spasmodic cough where the face turns bluish, the expectoration is offensive, and in cases of neglected pneumonia. And critically, that symptom again, the breath is cold and the patient must be fanned.
Must be fanned. It keeps coming back.
It's central. There can also be hemorrhage from the lungs and asthma, particularly in older people, again with that characteristic bluish skin.
It really paints a picture of a body struggling for every single breath. What about the extremities, the limbs? They sound pretty affected too.
Yes, the limbs feel heavy, stiff, sometimes almost paralyzed. They have a tendency to go to sleep, that tingling, numb sensation. There's a general lack of muscle power. The joints feel weak. Pain can be felt in the shins.
And the feet.
Cramps in the soles are common, and the feet themselves can feel numb and sweaty. A very distinct symptom is coldness, specifically from the knees down. The toes might look red and swollen, and there can be a burning pain felt deep in the bones and limbs.
How does fever present in this Carbo state? Is it high fever?
Interestingly, for fever, you often see coldness, but paradoxically with thirst. The chill typically starts in the forearm. Burning sensations can pop up in various isolated spots around the body.
Burning spots?
Yeah, and perspiration can actually occur while eating. It's also indicated in hectic fever, that's a low-grade persistent fever with exhausting sweats.
And finally, the skin. How does all this internal trouble show up on the surface?
The skin tends to look blue, cold, and ecchymosed, bruised easily. It could appear marbled, because of the venous overdistension, that pooling blood near the surface.
Right.
Itching is a common complaint, worse in the evening and when they get warm in bed. The skin is often moist, but with hot perspiration. It's a remedy considered for senile gangrene, tissue death common in the elderly, especially if it starts in the toes. Also for bed sores.
And wounds.
The skin bleeds very easily. Hair loss is also common, stemming from the overall weakness. Patients can develop indolent ulcers, slow healing ones, often with a burning pain. Any discharge from them is typically ichorous, thin, and watery and offensive, with a strong tendency for gangrene to develop right at the edges.
Gangrene again?
Yes. Purpura, those purple spots from bleeding under the skin, varicose ulcers, and large painful carbuncles are also mentioned in connection with Carbo Veg.
Okay, that's a huge range of symptoms. Now, to really understand how you'd use this remedy, you mentioned modalities earlier. Could you explain that?
Sure. In homeopathy, modalities are simply the factors that make the patient's condition reliably worse or better. They're crucial for finding the right remedy.
Got it. So, what makes the carbo state worse? What are the aggravations?
Boericke is quite clear. They feel worse in the evening, at night, and in the open air. Cold also significantly makes things worse.
Okay, cold is bad. Any foods?
Yes, specific foods are problematic.
Right.
Fatty foods, butter, coffee, milk, and also wine. Warm, damp weather is also generally bad for them.
All right, and crucially, what makes them feel better?
This is key, and it points right back to that core principle we started with. They feel better from eructation, from burping, from being fanned, and from cold.
Better from cold, but worse from cold air.
Better from being fanned, which is moving air, and sometimes from localized cold application, despite the general chilliness. That extreme need for moving air, for fanning, and the temporary relief from releasing gas are just central to applying this remedy, whether it's for digestive upset or those states of deep collapse.
That really ties it together, doesn't it? Connects all those symptoms back to the imperfect oxidation. And just briefly, what about its relationships to other remedies? Does Boericke mention comparisons or antidotes?
He does. In terms of relationships, its antidotes, things that might counteract its effects if needed, include spirits niter, camphor, ambra, and arsenic. For comparison, it's often studied alongside carbonium, that's lampblack, and also lycopodium, arsenicum in China, because they share some similar symptom areas.
Then complementary remedies, ones that work well with it.
Its complementary remedies, which might follow it well in treatment, are listed as kali, carb, and drosera. And for dosage, the source suggests the first to third trituration, that's a lower potency, less diluted for more acute stomach issues.
And for deeper issues.
For chronic conditions and those states of collapse, the 30th potency and higher are indicated. These are more diluted and generally used for deeper, more constitutional effects. It just highlights the practical side of how it's used in homeopathic practice.
Wow, what an absolutely immense scope Carbo Vegetabilis covers. From that core idea of imperfect oxidation to these really specific, often paradoxical symptoms that the cold body, hot head, the desperate need for air, even when nearly lifeless.
It's quite something.
It's truly striking how one single remedy source, vegetable charcoal, can encompass such a wide range of seemingly disconnected physical problems head to toe, all apparently tied together by this underlying state of profound debility and a stagnant vital force. It really paints a unique picture. Well, thank you for joining us on this deep dive into the very specific world of homeopathic materia medica.
Absolutely. And what's really fascinating here, I think, is how this seemingly simple substance, vegetable charcoal, can address such complex and frankly profound states of human collapse and weakness. It really emphasizes the unique lens homeopathy uses to look at health and illness, focusing intensely on these detailed symptom pictures.
It certainly does.
So it maybe raises an interesting question for you listening. How might understanding these incredibly specific, detailed symptom patterns enhance your own appreciation for different healing philosophies? And maybe more broadly, how closely observing details in any field can lead to some pretty surprising connections, something to think about.